Make a list of your 34 best friends, and then imagine putting a line through them. That's how serious this is.
Governor Eric Holcomb reiterating the need to hunker down tonight as the state reports 34 new coronavirus deaths and hundreds of more positive cases. State leaders also announcing more virus-related deaths at several long-term care facilities across the state, Brooke.
Yeah, that includes one in Johnson County, another in Madison County, where 4 people have died in recent days at each. That's on top of the 11 deaths that we told you about yesterday at a separate facility. State Health Commissioner Dr. Chris Bach says there are now 11 strike teams testing statewide, one for each of the state's preparedness sites. She says another 5 to 10 will be created in the next week or two. They've already visited one of the 700, every one of the 700 long-term care and residential treatment facilities in the state to remind staff of the signs and symptoms to look out for. Their job now is to be able to test people with coronavirus symptoms within 12 to 24 hours of showing symptoms to keep it from spreading.
The goal there was to make sure that individuals could be tested in the long-term care facilities, in the residential facilities, so that they didn't have to be moved to a hospital system to be tested and sit in an emergency room where they might actually get sick with COVID-19 if they didn't have it.
In all, 173 Hoosiers have died from the coronavirus. The state also confirmed 568 new positive cases, the largest single-day jump yet. The statewide total now at more than 5,500. Our team coverage begins now. We will get to Aaliyah Hodges in just a moment. But first, Travis Robinson spoke to a local nurse who says some of her first coronavirus patients are now leaving the hospital.
COVID-19 unit workers say the virus is scary. When patients come in, they don't know if they're going to be able to leave. But when they do finally get to be able to leave, employees say the end is in sight. When the virus first started and hospitals converted to COVID units, nobody knew what to expect. Frontline healthcare workers saw firsthand the horrors of the virus, and they didn't know what to do.
It's just patients asking me, like, am I going to die? You know, what's going to happen? And I don't really have the answers. They're scared, and that's probably the low point for me, is I don't have a whole lot of answers. And then just coming home and dealing with my family, because my kids are little and they just don't understand why I'm under stress and why mommy's crying and, you know, why they can't give me a hug as soon as I walk in the door.
They've been thrown into the deep end for the last couple of weeks, and at this point, Bradley says they're finally adapting to the new normal.
We kind of know what we're doing now, but it's just scary because of the unknown of the changes.
IU Health says they have around 49% of their ventilators in use right now on their 225 patients, which may seem like a lot, but IU Health says that's about the amount of ventilator use they had before the pandemic. And now they're seeing people start to recover.
So I got to give them their first meal, which consists of applesauce, but it's the best applesauce they've ever had. And so that's a bright point, you know, that like, okay, we know what we're facing and we're coming out on the other side of it.
It's not time to celebrate because we still haven't hit the peak.
We're spending our days and nights planning for it to get worse. We're hoping it doesn't, but we don't want to get caught short.
But employees say the recoveries and adapting to the new workflow gives them hope that the end is in sight.
Yeah, I mean, I think we'll probably be overloaded a little bit with patients if it goes like it has in other states and other countries. I mean, I feel like it'll happen, but I feel like we kind of are ready for it as much as we possibly can be ready for something like that.
If you'd like to help, there are plenty of organizations accepting mask donations, but the biggest help is just to stay home and stay healthy. I'm Travis Robinson, Wish TV, wishtv.com, and follow us on Facebook.
All right, Travis, thank you. A Brownsburg firefighter now on a ventilator suffering from the effects of coronavirus.
His friends and family keeping a watchful eye and a positive spirit. News 8's Aaliyah Hodges spoke with his family.
Kevin Byron has been in the ICU here at Hendricks Regional Hospital for the last week. His wife tells me his condition hasn't gotten any better. A Brownsburg firefighter for more than 20 years and public information officer for the department, Navy veteran and volunteer with Indiana Task Force 1, Kevin Byron is fighting the biggest battle he could ever imagine. He has a wife named Rebecca and 2 children. Rebecca says he caught COVID-19 while on the job. It spread to the entire household.
Realized it, came home, started feeling sick within a couple of days. The rest of us started feeling sick within a couple of days. And it just sort of progressed from there.
Rebecca and the kids has since recovered, but it hasn't been easy for Kevin. He was taken to the hospital. It was the last time his family saw him.
Literally was one of the hardest things I've ever had to do in my life, which is drop him off at the front of the ER and drive away. I couldn't kiss him. I couldn't do anything.
Now her husband's lungs and kidneys have failed him. He's on a ventilator and has an irregular heartbeat. She worries Kevin won't be able to see his family again, especially his son Aiden, who has special needs.
Losing Kevin is going to be extremely painful for a lot of people, but it breaks my heart to think that Aiden, my son Aiden, is going to have to deal with that because he just doesn't understand.
She is currently unemployed, and the Brownsburg Fire Department has been showing their support. They pray Kevin can come back healthy soon. In Hendricks County, I'm Aaliyah Hodges, Wish TV, wishtv.com, and follow us on Facebook.
All right, Aaliyah, thank you very much. We wish them well. Wish TV, proud to partner with the Indiana Restaurant and Lodging Association to host a fundraiser to support thousands of hospitality workers that are now out of a job. It's part of our upcoming Hoosiers Helping Hoosiers special. News 8's Sierra Hignite spoke with one of the many businesses that have been impacted.
Ben's Pretzels has 2 different locations here in central Indiana, and they are one of the many restaurants feeling the sting of the coronavirus.
Marie Damler owns 2 Ben's Pretzels franchises, one in Brownsburg and one in Southport. Since the coronavirus, her stores have seen about a 40% decrease in revenue. Damler, like many restaurant owners, has had to cut employee hours, with some employees not able to work at all because of immune suppression or having to stay home with family. She's trying to find any way she can to cut costs so she can keep her doors open. Different from other brick and mortar stores, her restaurant is a grab and go, and because her food establishment is located inside grocery stores, she has not had to deal with the same consequences that many dine-in restaurants have.
Basically breaking even. So to cut costs, we make sure we keep the bare minimum of supplies in stock, and I'm the owner. This is my son, so we're not taking any payroll, we're not taking any money out of it at all.
Damler says for her, business is similar to a winter storm situation, except this time there's no end in sight.
For more information on how you can help, you can head to our website right now. It's wishtv.com. Reporting, I'm Sierra Hignite, Wish TV, wishtv.com, and follow us on Facebook.
Sierra, thank you very much. Be sure to watch our Hoosiers Helping Hoosiers special on Thursday. During the all-day event, you'll be able to donate and bid on items from the Colts, Pacers, and Indy 11. We'll also tell more stories of the people who have been affected the most. Again, that's happening all day Thursday on Wish TV and wishtv.com.